All right, so thank you everybody for being here with us today. Oh, I don't know why it's going on its own. Okay, there we go. So I'm Therese, Community Health and Wellbeing Strategist with mHealth Fairview, and I'm part of our Community Advancement Department. So our department works on all types of community health initiatives and projects, and I help to run our food access programs, and we'll be sharing about one of them today.
Great. And, my name is Janssen. I am one of the co-founders and also the executive director with the Hmong American Farmer Association, also known as HAFA, because it's such a mouthful here. We're a nonprofit organization that works with over 100 Hmong farmers in Minnesota and across the United States here. And currently manage a 155-acre farm. We conduct a number of bilingual, bicultural trainings and also research, as well as operate a food hub that secure contracts with our farmers to help diversify their market outlet besides the farmers market system.
So today we're going to be introducing our VeggieRX program, speaking a little bit about the benefits to public health and the environment, and then just talking about our partnership over the years and some creative solutions. Okay. So we thought we'd get started today with a little bit of trivia to get everybody engaged. So we're going to pop some questions up on our screen, and if you can, just type in some guesses in the chat. So
great. So the first intro trivia question that we have is who are the Hmong people? Like what are the kind of history that I want to kind of get everyone familiarized with who the Hmong people are. So I see some chats here, Laos, so that's great. Anybody else as well too? Great, yeah. Laos. That's awesome. So, you're absolutely right. I mean, Laos is it, but, based on, according to historians here, the Hmong people are an indigenous group to southern China back in the 18th centuries. And because of kingship and strife between the different principalities, that the Hmong started migrating to what is now Southeast Asia and start settling in the hillside of Laos, Thailand, and also Vietnam here. So way to go. And according to history, it's always been known as just Laos. Right? Our next question is, how many Hmong people are in Minnesota? Does anybody know? Any guess? Thousands. You're right. It is thousands. There are a lot of Hmong people here in Minnesota. And it is definitely one of the largest populations in the United States here. And you're absolutely right about that here. So in fact, actually in Minnesota, there's actually over 80,000 Hmong people that live here in Minnesota here. And actually we comprise of the largest Asian American Pacific Islander subgroup here. Minnesota, is not the largest, but the second largest Hmong populations across the United States here.
So any guesses for about what percentage of Minnesotans are estimated to be food insecure? Whoops, I did that kind of quick, sorry. So this is actually a stat from 2019, and we had that it was around 10%. That has actually gone up quite a bit. When I looked at this Wilder research report, they were saying, in 2020, obviously so much was going on. That's increased a ton. As of July 2020, they said that 7% of Minnesotans reported having some level of food insecurity, and they expect that to remain really high in 2021. How many CSA or community shared agriculture boxes were delivered in 2020 to our patients at Fairview clinics? Any guesses? over 2,200 last year, and we're planning to up that this year. So I'm excited to provide lots of fresh produce to our patients. So let's get started and talk a little bit about HAFA.
Yeah. So it's great. Welcome everybody here. It's exciting to be joining you guys. And thank you, Minnesota Public Health this annual conference as well too. So, the question is, who is HAFA? Who is the Hmong American Farmers Association? As I mentioned earlier, we are a membership-based, we are a nonprofit organizations that was kind of created to support and uplift Hmong farmers in Minnesota due to the inequities here that have been faced by Hmong farmers. Primarily because Hmong farmer has been such an integral component to our local food economy since the 1990s when they first started learning about farming, as well as getting assimilated with the farmers market systems here. But what really led, to the formation, the inception of HAFA was through an act of self-determination by our founding members here. As one of them had mentioned, that we need to stop waiting for people to save us, right? That we can save ourselves, right? As what was mentioned earlier, that we are part of the game-changing aspects here of the future here. Furthermore, that one of our founding members, our founding members also believed in a membership model that comprised of individuals who are like-minded and also with shared values to truly create systemic changes here. And so HAFA is a membership-based nonprofit organization that was created in 2011 to truly kind of foster the equity in the food and farming industries that is rooted in our whole food model, where we believe that, all aspects of the food and farming industry relative to access to land, market, financial assistance, trainings, and research, right, must be freely and simultaneously accessible to Hmong farmers to build intergenerational and community wealth. And you can imagine it's almost like a spoke to the wheel here, that each of these aspects of the food and farming industry, land, market, financial assistance, training, and research, is necessary in itself, but it doesn't substantially doesn't create system change here. So in order to really truly create intergenerational community wealth here, that they must all be simultaneously accessible here. So the mission of the organization is to advance the economic, social, and cultural prosperity of Hmong farmers in Minnesota through capacity building, cooperative endeavor, and advocacy to truly create a pathway or to spur intergenerational and also community wealth.
Thanks, Janssen. So a little bit about our VeggieRX program. Basically, we identify food insecure patients, and then they receive this fresh local produce, a CSA box or community shared agriculture each week, which they pick up from their healthcare clinic. So patients are enrolled annually before the growing season to this program, and that's the job of the providers, whether that's the doctor, sometimes it's the social worker, diabetes educator. So they're identifying these food insecure patients, and especially ones that have underlying health conditions that could be improved by having a healthier diet, and having them participate in this program if they would like. So we really started this as a way to increase access to locally grown, culturally appropriate produce for immigrant refugee families, specifically Karen and Hmong folk. And then we also provide some educational opportunities. So HAFA has a beautiful newsletter that they include with recipes every week, included in this box. And then sometimes we'll do cooking demos, and we'll do a farm tour. And this program started in 2015. HAFA actually approached us. They had received a grant, and so we decided to give it a try in one of our clinics that has a high Hmong and Karen population, and just started with a few families. It was wildly successful, and then every year we've really grown from that. In 2020, we were working with 4 clinics that HAFA would come to and bring, and anywhere from 10 to 40 participants at each of those clinics. So it has really been a great success and something that we're really proud of. So we do collect data, of course, and that includes pre and post surveys. We collect demographics, on participants, as well as some biometric data, some self-reported eating patterns and habits, and just questions about their health and well-being. So for, I guess in the interest of time, we're just going to highlight a little bit of our data from 2020. And in 2020, we had 81 participants enroll. So including their family members, that was about 334 participants, 200 of them being adults and 136 children. And as we mentioned, the vast majority were Asian American, primarily Hmong or Karen speaking patients. And then we've also since then, since the beginning, we don't have it closed off to other races and ethnicities as well. So we saw some of those as well. And then the majority of them are folks that are using public insurance, about 90%. And as I mentioned, these are the 4 clinics that participated last year with our HAFA VeggieRX program. So our Bethesda Clinic, Phelan Village, Rice Street, and Roselawn. And a vast majority of them are also using other federal food benefits. So that's just kind of interesting to see where they're getting their support. And then a few more highlights. We saw a 14% increase in fruit consumption from our participants last year, a 20% increase in vegetable consumption, and a 16% increase of participants that rated their diet excellent, very good from pre to post survey. And then another thing that was new just last year that we were able to track was that preliminary data showed that we had a statistically significant decrease in emergency department visits from our, or utilization from our participants that were in the VeggieRX program. So that was pretty cool. And then these are just some recipe picked photos that some of our participants shared with our front desk or clinic staff at our various clinics. So we shared some of these, and you know, they always are really excited to get their food and come in and kind of share like what they're making and what they're up to with their family. So it's been a really cool way for clinic staff to really engage and build stronger relationships with the participants. And the participants have always had very great things to say about the program and how it's affected their health and their well-being. So, you know, food insecurity, a very important, large social determinant of health, and one of these kind of upstream things that we're doing to help public health in general. So when we're addressing food insecurity, we're really addressing so many things. Obviously, physical health, when folks are able to eat better, then they can improve their health in so many ways, but also mental health. Having a diet high in vegetables has been linked to improved mental health. And then also just thinking about not having to deal with the stress of being food insecure and not knowing where they're going to get their next meal. This little diagram here I thought was really powerful and telling that often when folks are food insecure, they're making these choices between, am I going to buy my family food, or am I going to pay for my utilities or rent or transportation? So when we can take that food out of the equation, then we're really helping to improve housing outcomes, education, and definitely as well the cost to healthcare. Like I mentioned, the emergency room utilization. And they also estimate that about $160 billion is how much hunger costs the US economy in poor health outcomes and healthcare costs every year. So like I said, an important upstream intervention that we can do is be addressing food insecurity. And then another cool study, we hired, I believe it was Ecotone, to do a return on investment study for us with this program. And they came back with this pretty amazing that every $1 invested in the VeggieRX program has a $16 return on investment. And they were like, wow, that's one of the highest returns we've ever seen on any of the projects that we've done this on. So really, and that is spread over not just Fairview and our healthcare system, but also the farmers, the cost to patients, health insurance, and government agencies. So really a proactive approach rather than reactive. Anything you would add, Janssen?
Yeah, no, I mean, I think the biggest thing is that as Therese has mentioned here too, I mean, there's so much public health benefits that came out of that as well. It's not about, just supporting farmers, healthcare, government agencies, but it's about increasing people's self-efficacy and how they perceive themselves from a mental health perspective, as well, in addition to being that whole proactive approach. And in particular here, a story that Dr. Les, one of the physicians here who is actively engaged in the VeggieRX program, had shared a story with us that he would meet with his physician on his patients on a regular basis here because they're diabetic, and he would always like, oh, are you taking your medications? And they're like, yeah, no, but not really, knowing in his mind that the patients are not really taking the medication to really control their diabetes levels. But the biggest thing is that he had promoted alternative solutions, which is the vegetables, the VeggieRX boxes here, of fresh produce that grown by Hmong farmers. And in response to that, and knowing that there was a trade-off here, that if he couldn't have them take the medication, if they could have a healthy diet, that in itself could help that individuals, right? So that's one of the biggest things that we found that very beneficial was that the promotions of the VeggieRX program had significant public health impact in terms of elevating the person's well-being from a diet perspective, as well as from a social connectedness here, building relationships between patients, physicians, patients, and clinics too. So the other thing that we look at is like, what are the benefits of it to the environment here, of course, right? First of all, we know that, they're locally grown produce here. So because they're locally grown produce here and that they're being distributed within the community here with this small area, that really minimize, the carbon footprints here that impacts, climate changes and whatnot that we know we've been experiencing for the last decade or so here and continue to fight. I think the other thing is too is that what it is on the HAFA farm, we manage a 155-acre farm that provide land tenures to a number of Hmong farming families here. And in that, on the farm here, we will model various different sustainable practices, anywhere from soil health, soil fertility, as well as the impact of soil and water quality relative to mixed vegetable production. The other thing is that on that farm here, we would also take land out of production here to really to kind of enhance the ecosystem by establishing like pollinator habitat. That includes an apiary on the farm that consists of like 14 beehives that is managed by our farmers as well as HAFA staff here too, to really elevate that whole notion of a vibrant ecosystem, right? So that's one thing. The other thing is definitely the fact that we are also increasing local food production to our communities, right? The environment is not about just the land use, but it's about communities here and making sure that everyone has access to fresh, locally grown, healthy produce.
All right. So, Janssen already spoke to some of the benefits of us being able to support local farmers. And really, that is part of our anchor institution value as an institution at Fairview. So we, being an anchor institution, meaning that we're really trying to uplift the community and the folks right around us in our neighborhoods where we are. So, I've seen, or we could obviously like give patients access to vegetables through Cub or something, but We would much rather be supporting local farmers and getting that fresh produce that's so much better quality anyways. And so that's something that has been really beneficial to both of us, as well as just providing us access to each other. So, HAFA has access now to a clinic setting where they can give their produce to patients and try that out. And we have access to a farm and produce. I've seen some healthcare institutions that maybe try and have their own community garden and grow food for their patients, which I think is awesome. But, why would we do that when we have farming experts who would be much better at it already here? So we can just utilize them. And then having that secure market outlet for the Hmong farmers, that reliable, steady income, it's guaranteed every year. We are going to be buying this many CSAs, so then they just don't have to worry about that. And then, as we spoke about the community relationship building, so going back to our farm tour, this is one of the more popular kind of events of the year. And we weren't able to do it in 2020 because of COVID, but every other year we've had this amazing farm tour where we invite participants from the program as well as staff to the HAFA farm, and we'll have a community meal, and they get to meet some of the farmers, tour, see where their veggies are coming from. And it's really impactful for both patients and the staff to be able to see where that, what they're eating every year or every week is, coming from right in their community. So some of the challenges that do come with this partnership are obviously we're in Minnesota. So the growing season, you can talk a little bit about that, Janssen, if you want.
Yeah, definitely. I mean, the biggest thing is that we are all experiencing it right now, right? In March, we were like 70-degree weather. In April was who knows what happened here, gloomy and 40s and rainy. It's that uncertainty of Minnesota weather as well too. Definitely that contributes to climate changes here. That really impact and makes farming really bottled by Mother Nature here. So that's definitely one of the largest challenge that we are faced with on a year-to-year basis here. With that here, with the weather changes and everything else, that also impacts, pest management here. With warmer weather here, that we introduced the pest musk early in the seasons as opposed to later, and that just follow gradual progressions of our growing season here in Minnesota. And of course, towards the end when we're just like, okay, getting rolling here, all of a sudden we get this nice little cold spells or really cold weather like we did last year, where in October we were in kind of freezing weather and snow and whatnot here. So that's definitely, those are some of the largest challenges that we have with growing season. And because of that also limits the opportunity here to really successfully make this whole VeggieRX program a year-round program. Some of the other challenges that we run into is like COVID. Of course, it's not just HAFA, it's just not mHealth, but it's all across the world here. The pandemic has had such a large impact on us, on how we care ourselves on a daily basis. Primarily for farmers is, what does that mean for our markets? Because their primary market has always been the farmers market system. And with social distancing regulations and guidelines here, that really, provide kind of a really scared consumers to come to the farmers market here. And when about 70% of their revenues are being generated from farmers market, that takes the big hits for our farmers here. So clearly, that was one of the biggest challenges. But of course, this relationship that has been established in collaboration between mHealth and HAFA have helped kind of sustain that, especially with all the unexpected expenses that came as a result of the pandemic. Yeah. Of course, the last but not least, is definitely the racial disparity here in food insecurity, which was very obvious during the pandemic as well, too, that, BIPOC immigrant minorities, were disproportionately impacted by COVID. And clearly, that really stressed and elevated the need for, increased access to healthy food. And clearly that in that sense here, promoting this was a potential solution here to minimize this impact here. And we are so thankful to have this relationship because through this that we're able to provide, our participants with access to just not locally grown produce, fresh, healthy, locally grown produce, but also culturally appropriate produce here to kind of meet the demands and also the diets of the diverse communities that we're living in as well.
Yeah, and just a couple statistics around Minnesotans with food insecurity. So Black and Hispanic Latino Minnesotans reported food insecurity at more than double the rate of white residents. And this was data from 2020 that 83% of Black residents and 70% of Hispanic residents were reporting some level of food insecurity compared to 32% of white residents. So as Janssen said, we were already doing this, but it felt really nice to be able to offer this additional support to some of our communities of color, to be providing them with this healthy resource, and especially our Asian American community members, to be providing them with this extra support right now. So, and jump in, Janssen, as we kind of talk about some of these solutions, which we've already touched on, but really over the course of the program, we started with only working with Karen and Hmong populations, and now we've really expanded that to anybody that's food insecure and needs it. So while we do still focus on BIPOC populations, we are expanding that as the I guess, program grows. And another expansion that we've had is this year we're working with a new farm called Sin Fronteras. And so we are kind of focusing with this farm, which is a Latinx ran farm that's local. So we're focusing on our Latinx population. So we have 2 new clinics that are participating in the program in 2021 that have a high Latinx patient population. So we're excited to kind of expand this model that we've really kind of gotten great at with HAFA, and try it out with another additional farm and focus population. And then do you want to talk about how we're expanding the season this year with you guys?
Yeah.
Janssen?
So this is great. I know we'll be talking about the next bite too, but definitely looking for other solutions here, right? Considering that, we have such a short growing season here, what are some potential solutions? And so what HAFA has established is, a more cooling, caring facilities here, especially when we dive into the later month and the later seasons here, focusing heavily on like a lot of root crops here, how to really properly care them or elongate the shelf life of the produce here to really expand our CSA program. And with that being said here, that we're looking to continuing our CSA program beyond Thanksgiving here, and truly expand it through the end of the year through December here with a winter CSA market.
Yeah, and then, we continue to kind of make tweaks from year to year, and have really found that having a lot of clinical support is obviously probably one of the most important things, besides what's going on at the farm. But it takes a lot of capacity from the clinic and a lot of buy-in. So having the providers on board and having that support system set up at the clinic has been really important. We usually have the clinic come up with a VeggieRX lead person, so one of their staff that sort of helps be that touch person at the clinic that we communicate with and kind of troubleshoot with when anything comes up with the program. And so having that in place has been really helpful over the years, and has helped us to be a lot more successful. So we kind of already talked about this. Okay, we're piloting the winter CSA, expanding the season, which is really exciting for us since, usually everybody's used to getting their fresh veggies and then we have to cut it off at Thanksgiving. But this year we get to continue that through the winter, or excuse me, through the end of the year. And then as I spoke about, expanding to additional clinics with our Latinx farms in from Therese. And additionally, we've been working with the Women's Environmental Institute and have been expanding in clinics in central Minnesota. So that's been really exciting and really popular program up there as well. And then we continue to work on our sustainability. So this has been largely grant funded so far. Every year we're kind of scraping together like what grants can we get, that kind of thing. So looking forward to, this is something that has such good return on investments. This is something that health insurance companies would be interested in, hopefully, and really helping them to save costs later on. And as part of that, continuing our evaluation, so having this really robust data that we make sure that we collect, and we make kind of tweaks year to year, depending on if there's additional things that we think we want to know about participants or program. And that really helps us make our case for why this program is so great and impactful.
Right. I just also wanted to add, I think that the other thing too is that the evaluation really support us, especially when we're talking about sustainability and how to promote, legislators and policies and truly create systemic changes here. Looking at different avenues, and those evaluations will really support that. Because clearly we know that having access to healthy food, is not just, a one-stop stop, but at the end of the day, it's a more of a proactive approach to creating a healthy environment for all community members.
Yeah, and really trying to create that sustainable future and environment for our communities as well. So, some of this large scale farming is not sustainable, as I think everybody knows. And so it feels really good to be supporting HAFA, who is caring for our land and our environment, and helping to do our part.
Great.
And
So I guess we open up for any questions at all here too.
Thank you so much, both of you. This is really great information, and just it seems like such a neat and innovative project. We did have a question earlier on about the return on investment that you mentioned for the study that was done, and whether you have a link to that, or have you published that information yet? Is it going to be published at some point where we could link to it?
Yeah, I'm happy to share that. I had a whole graph and then I decided to take it out just because we had too many slides, but we have that and we can share it with you, and it kind of breaks down, all the $16 and how they came up with that. We don't have that published publicly anywhere, but I'm happy to share it if you want to email me. My email is tgenis@healtheast.org. I should have put our, I can put that in the chat too. I should have put our emails on here.
Thank you. It looks like we do have another question too. Does your evaluation include changes in health outcome?
Which health outcomes do you mean?
Judy,
I think one of the
just go ahead. Sorry.
No, maybe let me know if I'm answering this correct. Based on the studies here and what we found here through mHealth is that, one of the controls was like A1C levels for diabetes, patients with diabetes. And during the course of the actual VeggieRX program that we have shown, it has shown that their A1C level has been reduced as a result of healthy consumptions.
Yeah, thanks, Janssen. That's probably what they're asking. I was like, there's lots of health outcomes. So yeah, we collect their BMI, their A1C, blood pressure. Those are kind of the main things that we ask. And we have seen improvements, and it kind of varies from year to year on what they are. And there's always these cases where it's like these huge improvements, and then some folks where it's more minimal or small or no improvements. But yes, overall, there has been improvements to health outcomes as well.
And then there's another question about whether the medical providers include the person's participation in this in their medical records.
You know, I'm not actually sure about that. I can ask and get back to that person. Same thing if they want to email me. I know that something we are working on is having this universal screening for food insecurity. That's part of our like EPIC system. But right now it's not, or it's at some clinics and not at others. So it's kind of just based on like us relying on the providers to ask that if it doesn't pop up. So I think if it's a clinic that has that as part of their EPIC, then they probably do note that. I'm not really sure though, because I don't ever go into medical records, if that's standard practice or not.
That's great. We just have a couple of minutes left, but I wanted to say again, thank you so much for this presentation and this information. I just love a more proactive approach to dealing with issues that, and especially a proactive, culturally sensitive approach. Just amazing to be able to provide people vegetables that are appropriate for the foods that that they would like to cook or are culturally, you know, significant. So I just love this project, and I love driving by the HAFA farms. I think a couple of us were talking about that, driving by on 52. They just always look so well tended and green. And I knew some of the background, so it's even more exciting to hear you both talk about this.
Thank you.
Thank
And definitely,
you.
as I mentioned in the chat, in better times, feel free to just stop by as well too. We'll love to be more than happy to schedule a tour and get everybody out there, just kind of see what's really happening on the HAFA farm as well.
That would be amazing. Thank you so much. I think there's a few of us who would like to take you up on that. So I think we'll like give you a round of applause in our videos. Whatever. And thank you again.
Thank you. Yeah, feel free to reach out if you have additional questions or want to hear more about the program. Thanks for being here, everybody.